I want to talk about Hank Hill's prostate. And, actually, I do. So, we all know Hank has a narrow urethra, and Hank was on the plane coming back from Saudi Arabia in the first episode, and Hank is having a hard time urinating. Now, I'm not a doctor, this is not medical advice, but there are a number of things that can cause difficulty urinating. One of those things is a narrow urethra, another is an enlarged prostate. If you have back pain and you have trouble urinating, that's often considered a red flag sign of cauda equina syndrome, which is something that generally needs to be dealt with as a surgical emergency. So, a lot of times in the original run of the series, they would talk a little bit about Hank's medical issues, and he would be real embarrassed about the narrow urethra, and he got really embarrassed about the narrow urethra here. But Hank is now 49 years old, and as you age, if you have prostate, your prostate enlarges. So it starts as a really tiny gland when you're born, and then during puberty it doubles in size to the size of a walnut. And then, as you continue to age, it continues to grow. DHT is what causes it to grow, and then it's in a benign enlargement. Now, it can either be a hyperplasia or a hypertrophy, depending on if the cells become bigger or if the cells become bigger and there are more cells. But what happens is the prostate ends up closing in on the prostatic urethra and pinching it, making it difficult to urine. You often might have things that people refer to as lower urinary tract symptoms. This can include dribbling, split urine stream, difficulty starting and stopping, weak flow, things of that nature. Now, at the age of 49, Hank has a 49% chance of having benign enlargement of the prostate, as a person's age is, in general, their percent chance of having a benign enlargement of the prostate. Something like 80% of men by the age of 70 have an enlargement of the prostate. And by age 75, basically 100% of men have an enlargement of the prostate. Based on the fact that I believe Hank does not engage in the activities that he needs to do to ensure prostatic health, which includes multiple times of the prostate being used for its intended purpose per month, studies indicate that 7+ times of doing that is what helps to ensure the prostate doesn't enlarge, and Hank more than likely would not be taking any sort of medication such as finasteride. I believe that Hank Hill has an enlarged prostate, and I think King of the Hill doing an episode talking about that would have been really good. As we know, King of the Hill did some episodes that touched on real social issues. And I feel like the Manosphere episode would have been a great time to talk about that. Because a lot of the times in those Manosphere podcasts, they don't talk about, true things affecting men's health. They don't talk about enlarged prostate. They don't talk about, men's mental health. They pretty much just talk about how females be making it so that the men don't have good health. But what they could have done, I think they could have extended that episode into a 2-parter and had Hank explore some of his health issues and show how, exploring your health issues and getting them treated is a much better way to deal with men's health than just joining, Andrew Tate in the Manosphere.